Welcome to Do Your Headaches Start in Your Foot? Thank you so much for being here. We are going to explore tonight how headaches can be related to what's going on in the rest of your body. So let's go ahead and get started. So, as a way of introducing myself, let me just tell you a little bit about me and why I wanted to do this presentation. I am a licensed acupuncturist in the state of California. I am also nationally certified to practice acupuncture and herbology. And I have been in practice since 2002. And in addition to my studies in Chinese medicine and acupuncture, I have also studied and earned a certification in what's called posture therapy. And posture therapy is essentially helping the body realign through therapeutic exercises. And I've also studied Qigong and Tai Chi, which are meditative movement practices that also emphasize posture. And the reason I expanded my studies into those areas was because of the following scenario. I would find that acupuncture would work for a lot of people. They would come in with pain, they would complete their acupuncture treatments, and they would get better. But there was a smaller subset of people that acupuncture would help, but would not completely resolve their problem. So what that would look like would be, for instance, they would come in for shoulder pain and they would feel better after their acupuncture treatment, but their pain would return after several days. And then by the time they got back to me, we would kind of be starting from the ground zero again. Or maybe the acupuncture helped and they completed their series of treatments and they felt better, but they would be back several months later with the same pain. And I wanted to know why that happened. And as luck would have it, I worked with somebody who practiced and knew about posture therapy and introduced me to it. And this turned out for a lot of cases to be the missing piece. And so because part of my practice, a good deal of my practice is treating chronic pain, it's very, very relevant. And I wanted to share it with you in case it was a missing piece for you as well. So what we're going to talk about this evening is we're going to discuss how to treat headaches proactively with this approach. And we're going to discuss what posture is and what it isn't. There are some misconceptions about that. And then an explanation about how that really relates to headaches if we're looking at the entire body, and learn how this can be a solution that is natural and you can be empowered to look at the root cause of the issue to help address your headaches. So headaches. Here's the situation. Headaches are the most commonly reported type of pain that's treated clinically, and up to 80% of the US population occasionally have a problem with tension headaches. But up to 3% of people have chronic struggles with tension headaches that really disrupt their life. And women tend to be more likely than men to have headaches overall. And this includes both tension headaches and also migraines. And migraines, just as a quick note, migraines do involve head pain, but they're more than just a headache. They are classified as a neurological disorder because they can have other symptoms such as weakness, visual disruptions, nausea, vomiting, sensitivity to light. So I'm discussing them as headaches, but please know that they are considered a neurological disorder, okay? But in terms of the statistics, you can see that a good number of people suffer from them. 18% of American women, 6% of men, and up to 10% of children suffer with migraines. And when people suffer with migraines, the vast majority of them can't really function and complete what they need to do on a day-to-day basis. So there is a toll that comes in human suffering, but there is also an economic cost. People, due to migraines, lose a lot of work days every year and have to call in sick. And that's bad economically for them and for their employers because those lost work days are also worth a lot of money. And there are a lot of different types of headaches. These are just the statistics for two common ones, the migraines and tension headaches. There are also cluster headaches, sinus headaches, and we're going to look at some of the triggers as we go along. So that is to say, these statistics demonstrate that for some people, headaches can be a real problem. And how it's addressed kind of traditionally in the mainstream medicine. You have everything from over-the-counter medication to ongoing medications. Botox is even used, especially in the case of migraines. And medication that are prescription can either be to treat the pain itself or to prevent it. There are also vitamin and mineral supplementation that can help. For instance, magnesium for people sometimes is very, very helpful. And then other things for stress management, such as meditation or biofeedback. But the approach we're going to discuss tonight through posture therapy is a holistic perspective that's looking at the entire body and really respecting and supporting how the body was designed to function. It is a non-pharmaceutical approach that is designed to empower each person with a solution that really gets to the root cause of the issue, so you have a long-term solution. Again, going back to what I said earlier about clinically seeing people who would have to come back for repeated treatments with acupuncture, if you address the postural issues, oftentimes you can really get at the root of it and create a solution where you don't have to be continually treated or medicated. So let's look at some common headache triggers. Obviously, there's a long list, and everything from fatigue to being stressed out or suffering from anxiety or depression. Hunger and blood sugar fluctuations can play a big role. In fact, blood sugar drops can be a huge trigger for migraines. So if you suffer from migraines, I really encourage you to make sure you're eating regularly throughout the day and making sure that you're having adequate protein to keep your blood sugar stable. Food sensitivities can definitely play a role, and those can be kind of sneaky sometimes. There can also be nutrient deficiencies such as low iron levels. Also changes in hormones, and this is thought to be why women suffer from headaches more frequently than men, because they, throughout both the month and the course of their lifetime, they suffer from more hormonal fluctuations. Also simple dehydration, caffeine, either too much or suffering from a withdrawal from caffeine. And definitely it's not uncommon for things like TMJ and bite problems and tooth infections to contribute to headaches. Also, fatigue of the eyes. We spend a lot of time on the computer and on our phones, and this can create a lot of eye strain. Smoking is a problem. It decreases oxygen and circulation, which can contribute to headaches. And then finally, what we're going to discuss this evening, which are postural problems, which is commonly called poor or bad posture. And we're going to talk about why maybe that's not the best description. So, posture. When we talk about posture, and I mentioned that I do posture, almost invariably everybody sits up just a little bit straighter and they throw their shoulders back, and then sometimes they look a little sheepish, like they've done something wrong. And that's probably because the common perception of posture is just standing up straight as if you are a Marine or a soldier at attention. But really, posture is more complicated than that. It's not just throwing your shoulders back or being able to balance a book on your head like a debutante. It's a whole body process that involves hundreds of muscles throughout your body. So it's a very complex process that you can't really control just by sitting up straighter or even consciously. It's more complicated than that. And what we look at when we do posture therapy is how your joints are aligned, and how your joints and bones are aligned are based on how your muscles are functioning. And instead of your posture being good or bad, it's more helpful to think about whether it's functional or dysfunctional. So when we look at what constitutes functional posture, what we want to see is what are called load joints. And those are your shoulders, your hips, your knees, and your ankles. And these joints should be aligned and stacked on top of each other and balanced from left to right. So they should be stacked on top of each other whether or not I'm looking at you from the front or back or from the side. And you want your pelvis in neutral, so that means you don't want your pelvis tucked under, so the lower back is flat, and you also don't want your butt sticking out, so your pelvis is tipped. You want it in neutral. And when your low joints are aligned and your pelvis in neutral, the head tends to be above the shoulders where we want it. And this is important because when your head is properly aligned, then it gets rid of a lot of neck and shoulder tension because gravity is now doing the job. Okay, for every inch that your head goes forward, your neck and shoulder muscles have to work that much harder, and it creates a lot of tension. Okay, in addition, your knees and feet should be pointing forward, and they should be pointing forward at the same degree. So if your right foot points in or out more than your left or vice versa, that's a postural issue. Also, when you look at yourself from the front, you should see the side of your hand. Usually what people see, if that's not the case, is you see the back of the hands because the arms are rolled forward because people might be slouching forward. So ideally, the side of the hand is what we're looking at when we're looking at you from the front. And most importantly, you want your posture, and this is the functional part, you want it to allow you to have full range of motion. And when your posture is functional, you can move all your joints how you need to. And also you should have plenty of energy because your body isn't having to work extra hard because of that tension. So you should be able to go about your business and have a wide variety of activity with no pain. And that's how we know that your posture is functional, which is great, but sometimes things go wrong. And your posture can be compromised due to an injury, maybe a sprained ankle, maybe a car accident, some sort of musculoskeletal injury. Things can also go wrong if you have kind of imbalanced movement or activity. So if you have some sort of repetitive activity at work, or maybe a particular recreational activity. For instance, I play dodgeball, and there is repetitive motion with the throwing action that happens. And if you do that without any sort of balance, that can create a problem. Your posture can also really be affected by what happens for you emotionally. So emotional trauma can definitely show up in changing how your posture works and how you kind of manifest and function on a daily basis in terms of your musculoskeletal system. Very often, for instance, people hunch a little bit because this is a protective posture. And so if there's a lot of unresolved emotional trauma, that can definitely show up in the posture as well. And then not only repetitive activities, but not enough activity. This is a huge issue, especially given how much we work on computers, how much we don't have to do a lot of the physical labor that our ancestors did. What's that saying? The sitting is the new smoking. So not getting enough activity, your muscles are going to get weak and things get imbalanced. And then there's also an issue that we call compensation. And compensation is both a good thing and a bad thing. And what compensation is, for instance, if you injure yourself, and let's say you sprain an ankle, and you have to limp because you have an injury, your body has to figure out how to work around that injury. So on the one hand, it's great that it can do this. It allows us to survive. It allows us to basically keep going. But the downside is it is functioning, your body is now functioning in a way that isn't necessarily according to design. And in the short term, compensation can allow us to survive, but in the long term, it can create its own problems. So it can create muscular habits in the body that then create wear and tear on the joints, for instance. And what compensation really does is demonstrate how complicated posture is, because your body has to adjust and change on a daily basis based not only on injury, but just the different kinds of activities that you participate in. So it's really a very complicated process. And it's amazing that our bodies can do it, but that can go wrong. And then that becomes something that we have to fix during the therapeutic process. Okay, so when we get to posture and headaches, the most common thing I hear, and I can't tell you how many times I've heard it in the past 18 years, where people complain that they store all their tension and stress in their shoulders. So almost invariably, people have tension in their neck and shoulders if they're suffering from headaches. However, just because you have tension in the neck and shoulders doesn't mean that the problem is actually in the neck and shoulders. The question really is, why do you have tension in your neck and your shoulders? And the vast majority of the time, the neck and shoulders, yes, there's tension, but there's also a misalignment of other joints in the body. And this can involve weakness or tension in other muscles. And again, the compensation that we discussed. So while you want to address tension in the neck and shoulders, that doesn't necessarily mean that we stop at doing some stretches for the neck and shoulders. We have to see what's going on in the rest of the body so we can take the pressure off the neck and the shoulders. Just like we talked about, if the load joints are lined up properly, then the head is usually carried where it's supposed to be. But if there's any slouching or rotation in the torso, that makes the head, the neck, and the shoulders off balance and creates tension because they have to work twice as hard. So an example of that, again, going back to spraining an ankle. So let's say you sprain an ankle and you don't walk on it normally or at all for 6 weeks. And that's going to create weakness in those muscles that normally keep your leg moving along like it should. And then the right knee, because all those muscles have changed, now starts to rotate inward. And the right hip and the shoulder are now a different height because the muscles in the hips have changed. And in order to maintain balance, the torso then rotates and the head is no longer aligned over the body, and you get neck and shoulder tension. That ultimately translates into a headache. But again, you see all the things that we have to fix before we just stretch out the neck and shoulders. And how do we do that? How do we fix that? Well, anytime joints and bones are misaligned or in a position that you don't want them to be, how do we change that? And that's to change the function of the muscles. And the good news is you can change how muscles function through exercises and movements. And the ultimate goal then is to create balance. Things should be balanced from left to right and front to back. And you can do that by stimulating the body with appropriate exercises and stretches that take into account the entire body, not just where you're having pain. So let me give you an example, a case study of somebody I worked with so you can see how the process works. So this was a 25-year-old woman who, as I mentioned, I play dodgeball, and so I tend to treat a lot of dodgeball players in my practice. She was a dodgeball player who came to me complaining of headaches, and the headaches showed up primarily on the right side of her head, and they had started about 3 months ago. And she had also noticed not only the headaches, but she was grinding her teeth a lot and waking up with a lot of jaw tension in the morning because she had been grinding at night. But she also complained of neck and shoulder tension that was on both sides of her neck and shoulders, not just the right. And when I examined her posture, there were some things that jumped out that were noticeable. So the first thing was that her left knee and foot pointed inward instead of straight forward. And as we went through some tests, she also kind of remembered and remarked that when she bent her knee, she would get occasional popping sounds or cracking sounds in her left knee. And as the tests revealed, her left hip was also tight and she had less range of motion. She had some more difficulty completing some of the tests with her left hip. Her right shoulder was also lower than her left, so not symmetrical from left to right. And her right shoulder was rolled forward and her head was rotated to the left and held forward of the shoulders a little bit. And part of how I think that this happened for her was going back to the activities of dodgeball. In dodgeball, you throw a lot and you also pump fake a lot. And so that throwing motion had created kind of a muscular habit, right? And if you think about what happens when you throw, you're moving your arm in a particular way, you're rotating your torso. And if you're right-handed, probably your left foot is forward and you're having flexion in your left hip. And so it's kind of this spiraling motion. And if you only throw to one side and that's your primary activity, you're not doing a lot of other types of exercises, then what can happen is you get a muscular imbalance. So it wasn't necessarily that she wasn't moving, but she was only moving really in one way when she exercised. So what we did was we created an individualized treatment plan that had a series of treatments to relax her hip and straighten out her torso. So while I was treating her headaches, that's not where we started, which is why I've kind of tongue-in-cheek talked about, do your headaches start in your foot? It could also be, does your shoulder pain start in your knee? Looking at that interconnection of the alignment of joints and how those muscles are functioning. And I also recommended to her that if she wasn't going to do any other kind of exercise besides dodgeball, that at least when she was warming up, she may also want to throw on the other side. If you're not left-handed, obviously that's going to be a bit awkward and you wouldn't want to do that during a game. But when you warm up, you can throw on the other side and that will balance things out. And you can think about, I'm talking about dodgeball, but there are other sports that are one-sided: skateboarding, surfing, snowboarding, those kinds of activities where one side maybe is more dominant or held in a different position than the other that aren't necessarily symmetrical. That these are examples of other places where you can get problems, but there is a solution, okay? And she did her exercises faithfully, to her credit. And after 6 weeks, we were able to get rid of her headache. She noticed she didn't grind her teeth as much at night, and her knee also quit popping. I don't know how her dodgeball game progressed, but her pain definitely got better. Okay. And so how the solution works, kind of clinically, how the appointment goes, is we begin with a postural assessment. And this includes doing photos of your postural alignment, and then also doing what we call functional tests. Again, just seeing how your body is working, seeing how your muscles react to different kinds of demands. And then based on those findings, we put together a personalized movement plan to help your body get back to functioning per design and fully functioning without pain. It does take almost always more than one treatment. It's a series of treatments. The treatments, because of our current situation, the service actually can be done online. So you can save yourself the traffic and the hassle, and through a video conferencing call, these series of treatments can be designed, take you through the exercises and the tests, and all of it can be done online. So we come to the part for any questions anybody has. And let me kind of preemptively ask some questions that are very, very common, kind of anticipate these. The first one is, how often do I have to do my exercises? And the posture therapy, if you really want to retrain your body, it is a daily commitment. And how long your exercises take per day, there is some play in that. I'm always mindful of what someone's realistic schedule is. So some people have 15 minutes per day. Some people have 30 minutes per day. Some people have 15 minutes in the morning, 15 minutes in the evening. And we really try to work around that because you have to be able to do your exercises to see results. And so that's the flexible part. If you're only doing 10 minutes a day, it might take a little bit longer than if you were doing 30, but that doesn't mean that the process can't still be done. So there is some flexibility there, but you should look forward to making a daily commitment if you really want to make a change. And then people tend to ask how long the process takes. This, of course, depends on your particular situation, but I would give it several weeks at least. Kind of the standard recommendation is 8 weeks. There's some give and take in that. Some people take shorter, some people take longer, but just know that it will almost always take more than one treatment. And each treatment builds upon the last. So One treatment gets you to a certain level of strength and functionality, and then we build upon that. And so we progress through a series of treatments to get you back to full functioning. Okay. Any other questions? Okay. So if you are interested, if you think this is one of your triggers and it's one way to address your headaches, if you want to get in on the action, so to speak, you should either call me or email to reserve a space for a 20-minute consultation where we can talk. I can listen to what you have going on and we can see if this is a good fit for you. Okay. Currently, because we're heading into flu season, I am getting busier, so there is limited treatment space. So if you want to move ahead with this, I really encourage you to call sooner rather than later. And the sooner you start the process, the sooner you're going to find relief. So feel free to hit me up. Here is my contact information. You can email me or call me. And also, if you just think of questions that maybe you didn't think of this evening and you want to know more about it, feel free to reach out. I would love to hear from you, and I would definitely love to help. I am at your service. Okay, this really is a proactive approach, and I know that it has really helped some of my issues. I've seen it help a lot of people. So if you're finding a lot of neck and shoulder tension and a lot of physical discomfort, or if you've had injuries that you think contribute to your pain, please reach out. Don't live in pain. Let's get this taken care of for you. All right, thank you so much for being here and tuning in. I hope you found the information helpful, and have a good rest of your evening.